have a model and I'll start by explaining anatomy. So I explain that your pelvic floor muscles go from your pubic bone at the front through to your tailbone at the back, and they have a supporting role, and they also have a role to close off your sphincters as well. So they're like a hammock, and that hammock, when you're birthing or using your bowels, has to relax and open. But to keep those muscles strong and fit, you actually do need to work on strengthening them. So to actually make that work, get them to sit on the edge of their chair with a nice upright posture, because when you're in that C or that J posture, everything's really relaxed. It's not going to actually tighten, it's designed to relax in that position. So to actually work them, you need to be sitting up nice and tall, nice curve in your back. Very good. And if you're not sure of what you're feeling, you can actually pop your hand on the outside of your kind of vagina, clitoris. You can feel from the outside as well. Inside, it's the action as if you're stopping a wee or trying to keep air in your back passage. So basically just gently tightening and lifting, and then releasing and lowering and relaxing. And you should be able to feel that happen inside. If you can't feel that release when you let go, you may not be releasing, or you might not have tightened. If you're having difficulty feeling what's happening internally, just pop your hand on the outside to give you some feedback, and you can feel that there. The important thing is keep your belly muscles relaxed and lift from underneath. If your tummy muscles at the front and your back muscles at the back are squeezing really tightly, you're not going to be able to lift the pelvic floor up. It's like a tube of toothpaste. If you're squeezing from in here, that poor pelvic floor won't be able to lift up. So keeping your belly relaxed, gently lifting inside, and then relaxing. Because if we teach them to do it really hard and try and get to that highest level, they're actually pulling their abdominals in a little bit. Yeah. So relaxed belly is really important.
Could you just explain while you're here what you were saying before?
So everyone pretty much these days knows that they should be doing some type of pelvic floor exercise, and for the majority of people that's a really good idea. But there are a percentage of women who we would classify as having high pelvic floor muscle tone that probably shouldn't be doing 100 a day. They actually need to be working on relaxing, releasing, and almost down training those muscles ready for birth, because doing too many of them can help them to increase their muscle tone, can give them pelvic pain, muscle tension, trigger points in muscles that just get really tight and unable to let go, and they'll end up with a bit more pain and difficulty birthing.
And what kind of percentage of women would you say that that's the case with?
It's really hard to say. I would say the majority will have, with practice, the ability to let go, but there will be a relatively small amount of women that find it difficult to actually release. Those, naturally more active sports women, your horse riders, runners, people like that, their poor pelvic floor is working hard enough already, and to add extra tone to that, it's that mind-body connection of actually relaxing, releasing, letting go that they need to focus on, rather than too much holding on.
And so physio can help with that?
Yeah, definitely, yeah.
And how many should the average woman, non-pregnant and pregnant, be doing?
So what the research and the evidence says is if you're working on strengthening your pelvic floor 3 times a day, between 10 to 12 contractions. Yeah. And that's enough to build up a muscle. But when they're pregnant, generally once in a day to remember, their pelvic floor, even if they're walking around, is still working to hold everything up there. And we don't really want to add so much into that it becomes fatigued. Yeah. So, yeah. And in pregnancy, it's probably better to get them to do it in a lying position, where they can take the weight off everything else and actually work on activating. If they're really fit and early in pregnancy, sitting's fine, standing's good, it's very practical and functional. But once they begin to get that low, heavy, then lying down is a perfect position. Really.
Thank you.
Fantastic.